After a mounted battle for COVID-19 vaccines, Africa is facing another fight as monkeypox spreads globally. The continent has reported the highest number of deaths, but richer countries are snapping up the only available vaccine.
To my knowledge, no vaccines that are currently being distributed in Western world, in US and Europe, or the antivirals have ever been offered to African countries.
Central and West Africa grappled with the zoonotic disease for several decades. It's now easily passed between humans through close contact and has for the first time breached the borders of Ghana, Morocco and South Africa.
We're really going to be highly reliant on community awareness, education, and certainly access to testing. So we've expanded testing beyond the NICD, that's going to be very important, as well as in terms of the tracing is also going to really be critical as well, to try and ensure that we can identify cases fairly early on to try and prevent transmission within, if they are high-risk communities.
Despite progress since COVID-19, vaccine development remains largely hampered by small budgets and a lack of international commitment.
We definitely need our own vaccine production. We need to invest in our own research and development. We have excellent researchers all around the continent, that need to be supported. We need better diagnostics, and we need to push our own agenda.
You have to look at, say, preclinical, clinical, and post-clinical events. It's really important that these international events, these initiatives, put together these different blocks of activities in order for us to be able to actually produce an effective vaccine. But it's really coordination and investment is really going to be very important.
Monkeypox has been declared a global emergency, but it's far less infectious or deadly than COVID-19. Most people who fall ill will recover from it. For the younger or immunocompromised African population, there's little protection against severe infection without vaccines.